let's get this started. Hi, everyone. Welcome to Those Millennial Pediatricians. I'm Dr. Deshna.
And I'm Dr. Niksha.
And today we're going to talk about what we're all in the thick of, which is respiratory season.
Truly in the thick of it.
Everyone's sick right now. Before we get into the episode, for those of you that are new here, we wanted to introduce ourselves. For those of you that are hopping on for the first time, we are two pediatric resident doctors in our third year of residency, our last year of training, and we started this podcast in order to share more information and evidence-based medicine for parents in an informal setting, kind of like your friendly neighborhood pediatrician. So welcome to those of you that are new here.
Yeah, kind of like if we were Mr. Rogers, but women and doctors instead.
In medicine, yeah.
That's so entirely different.
I love that analogy. We want to give off that vibe completely.
But in this part, so we'll go over what respiratory season means and common viruses and any resulting symptoms that you might expect to see. And we'll also talk about specifically about bronchiolitis and RSV, since we get a lot of questions about these from parents, and this might be some things that you're thinking about as well. So we decided to split this episode into 2 episodes because there's so much information that we possibly can't cover it in one episode, or it would just feel way too dense. So we want to make sure that it's more digestible and reasonably timed. So if you want more information on how to prevent and treat illnesses during this season, you can check out our part 2 on our podcast series. But for now, we'll go a little bit more into what respiratory season means and the common things that we might see.
Exactly. So let's just hop right in and let's get to understand what respiratory season is a little bit, since we mention it so much. So what exactly is this? So this is the season that typically spans usually from fall to early spring. And this is kind of the time where viruses like the flu, RSV, which we'll talk about a little bit more later on, and viruses called rhinoviruses or enteroviruses tend to circulate more frequently. And it happens specifically during this 4 to 5 month period where people are just passing viruses onto each other because it's typically colder and viruses tend to thrive more. And then you're also kind of like in enclosed spaces during the winter a lot more. So it's just more infectious.
Yeah, for sure. And for those of you who have kids in daycare or school, you understand probably the pain of that. Like Deshna was saying, when you're inside more, those viruses can spread more likely. So kids in daycare or school are just more susceptible to catching these viruses, or these bugs, as we like to call them. And that's not necessarily a bad thing. So every child's immune system is developing, and as they get older, their immune systems get more mature because they've been learning for years on what kinds of things are out there and they've fought them before, so they tend to not get sick as they get older. But even healthy kids can have up to 10 episodes of illness in one respiratory season. Doesn't mean they can't get sick in the summertime too. We see a lot of other illnesses outside of that respiratory season, but there's certain ones that we tend to see during the respiratory season.
Exactly. And so common symptoms, so you may already know this, but just to kind of go over these symptoms and when you should be worried and seek better, medical attention. So first of all, the symptoms that you should be on the lookout for that gives you a sign that this is probably a viral infection is cough, runny or stuffy nose, sore throat, and fever. Fever is not uncommon. And it's also worth noting that some kids might experience wheezing or difficulty breathing, especially if they have asthma, allergies, or things like atopic dermatitis, or what we call eczema. So if you have kind of those constellation of medical, history, then you may have wheezing or difficulty breathing because viruses can trigger a lot of these reactions in kids. Just like that. Just like that. We gave you a live example.
I have crazy post-viral cough right now. And we'll decide if we're going to just edit that out. That's why I waited for you to be done so I could cough. Yeah, so another symptom that we sometimes can see is respiratory distress. And I think we'll take a second to talk about exactly what respiratory distress means, because you might hear your physician say those words, but you don't know exactly what that means. So respiratory distress just means that your child isn't able to breathe normally like they usually are because they're not feeling well for some reason. And they have to use accessory muscles and other muscles in order to help them fill up their lungs with air and breathe properly. So that can look like things like using their belly to breathe. So you see their belly stick out more when they're breathing in and out. That can look like things like retraction. So you're noticing their ribs stick out more when they're breathing, or their ribs tuck underneath when they're breathing as well. It can look like they're sucking in at the neck or even around their collarbones. Or sometimes it can even look like things like they're flaring their nostrils, or their heads are even moving up and down when they're breathing, or they're even grunting. So typically we say when you're going from the belly and up, as you're seeing more of those signs, the worse respiratory distress they're in. If you're noticing these things, these are things that you should seek medical attention for immediately. Just because those other symptoms are pretty common, this is one that can mean that they need some respiratory support or some additional help. And I think the other thing too is we often see sometimes certain viral illnesses just including nausea or vomiting. So sometimes those older siblings with the same virus just have nausea or vomiting, but they don't have that typical fever, cough, and congestion. But those are definitely common symptoms that we see too.
Yeah, and it's important to note that, cough, congestion, runny nose in and of itself aren't like dangerous symptoms or need immediate medical attention. Usually the symptoms will start to go away in about a week or so as the virus starts to clear out of the body. And similarly, a fever is not necessarily harmful to your child and doesn't need to be brought down right away, unless, you have a baby that's like unvaccinated, younger than like a few months old. That's a different story. But in an older child, a fever is just a sign that their body is fighting off an infection, probably because of the virus. But a fever that is like consistent, anywhere from like 5 to 7 days, and is not coming down at all with fever reducing medications like Tylenol or ibuprofen, can be a sign that there's something underlying that does need to be addressed. And Tylenol and ibuprofen can be given to reduce a fever for comfort, but not always necessary. If they have a fever and are, running and playing around, usually that's okay. So no need to, give something to them immediately unless they're in obvious like distress or uncomfortable or, unable to sleep.
Yeah, definitely. I feel like what we hear a lot from parents is their worry that fever causes brain damage. And I feel like a lot of parents don't tell us this, right? Like I'm sure you get this too, Deshna, but fevers do not cause brain damage. And so having that fever is not a worry that it'll permanently cause any sort of damage to the brain, like Deshna was mentioning. Okay, so while the respiratory season can cause a lot of symptoms, a particular manifestation of illness that viruses can cause, such as RSV, such as flu, other viruses as well, is bronchiolitis. And you've probably heard the term bronchiolitis a lot, and sometimes bronchiolitis can mean a hospital admission. So we wanted to take a little bit of time to explain this and talk about it.
Yeah, so I'll go through a couple of one definition, and then other symptoms and why we worry about bronchiolitis in infants. So first of all, what is bronchiolitis? So if you think about the technical definition, it's an infection of the smaller airways of the lungs. So if you think about the lungs as kind of, a tree starting from the top, going all the way down to the roots of the tree deep down, the bronchioles are kind of towards the end of those roots and are those pockets that are responsible for oxygen exchange and oxygenating your blood. And so when you have an infection of these smaller airways, this causes inflammation and narrowing. And we really see this in infants younger than 2 years of age. That's when we see bronchiolitis come up most often. And the symptoms are pretty similar, to any other upper respiratory virus or a viral infection. So that's runny nose, cough, you can get wheezing, you can get difficulty breathing, and you can get fevers. More often, you also see rapid breathing or signs of respiratory distress that Aniksha mentioned before, which is, kind of retractions, chest retractions. You can see flaring of their nostrils. That's just a sign that their body is in distress and they're not getting oxygen adequately. And why are these infants, at higher risk? So generally, younger kids or smaller babies, you have smaller airways, right? Your lungs mature as you get older, and so if you have these smaller airways and also combined with underdeveloped immune systems, you make these younger children more vulnerable, and so this leads to hospitalizations due to need for oxygen support. And for smaller babies, even we see babies come in with needing frequent deep suctioning due to a lot of secretions coming out due to bronchiolitis, and so sometimes they also need hospitalization for that too.
Yeah, and so while all the viruses we discussed previously and other viruses too we didn't talk about can cause bronchiolitis, one of them that parents ask a lot about and what you might hear about is RSV. So RSV, it's not a new virus of any sort, but it stands for respiratory syncytial virus, and it's the most common cause of bronchiolitis. It's responsible for over half to about 3/4 of cases of bronchiolitis in infants and young kids each year. We typically think about it in less than 2 years old, but I will say lately we've been seeing older kids get bronchiolitis from RSV too, which we'll talk about a little bit. So it is still the most common cause of hospitalization among infants during the first 12 months of life. And again, RSV does not equal bronchiolitis. So bronchiolitis, like Deshna said, is still that constellation of symptoms and the lower airways in that tree that she talked about. So we want to really clear up that misconception that the two are interchangeable, because they're not. But RSV can cause bronchiolitis or can cause other sorts of manifestations of illness too. So it typically spreads through direct contact, respiratory droplets, contaminated surfaces, the same as other viruses. And we'll talk a little bit in the next episode about how you can try to prevent some of these things.
Yeah, and so there are other viruses that cause bronchiolitis, right? So there's rhinovirus, there's influenza, there's adenovirus, so the list can go on. And they can impact the airways very similarly to how RSV does, and they can cause the same exact symptoms. But I also wanted to just share some data because I feel like, we love data. We are an evidence-based podcast, or we try to be, and we just want to give you some more information because it's just not talked about. So why do we care so much? Why do we talk about RSV particularly compared to all the other viruses that I just said can cause bronchiolitis? So just a few points. So in the United States itself, RSV infections lead to about 2.1 million outpatient visits and about 58,000, almost 60,000 hospitalizations annually in children under 5 years old. That's a lot. It's also the cause of hospitalization, the leading cause of hospitalization and lower respiratory tract infections for infants in the U.S., often up to children aged 5 years old, as Aniksha mentioned. And severe cases of RSV are more common in infants under 6 months, premature babies, and those with underlying conditions like congenital heart disease or immunodeficiencies. And it's estimated that nearly 100% of children will have been infected with RSV by the age of 2. So it's very common. It does lead to quite a lot of hospitalizations, and that's why we talk about it so much.
And that's not to say that older kids don't get RSV or like adults don't get RSV, but by that time our immune systems are just so much better and so much more mature. Exactly, yeah. So we don't get hit as hard as some of these younger kids do. So clearly RSV is this huge burden to hospital systems. It's a huge burden to families. It can be dangerous for younger infants like Deshna talked about. So if you've been to your pediatrician's office with your baby, you may have heard of Beyfortus, which is the brand name, or nirsevimab, which is a new form of protection against RSV. We used to have something called Synagis. We still technically do have it, but we are preferring Beyfortus for a few reasons, but we'll talk about for a second why that's so nice to have.
Basically, Beyfortus or nirsevimab is that new form of protection against RSV that kind of, just gained traction in the past couple of years as it was being developed. So it basically is a monoclonal antibody. So it's not the same form of like a vaccine that your baby will get at their usual While child visits, it directly passes on immunity to directly fight RSV, and the protection lasts for about 5 months, so basically the length of respiratory season, and it's recommended for the following groups. The first group is healthy infants under 8 months going into their first RSV season. So that's fall to spring. And this is generally for babies whose mothers did not receive the RSV vaccine during their pregnancy. I wanted to clarify. The second group is infants who are older than 8 months but have chronic lung disease of prematurity or who required extensive medical support, whether that includes steroid therapy or supplemental oxygen when they were born, anytime during the 6-month period before the start of their second RSV season. The third group is children who are severely immunocompromised, and the fourth group is children with cystic fibrosis, which, if you don't know, that can lead to, chronic lung disease as well. So those are kind of the 4 groups that it is highly recommended that they get the RSV vaccine. So just a little summary. But obviously, if you do have further questions or are hesitant at all or just would like to review more information, I highly recommend you talk to your pediatrician about it, the pros, the very, very little cons, if any, and just what that would look like for your child. And I also highly recommend visiting the CDC website. They have a whole section on, Beyfortus and nirsevimab. It can give you more data, as well as the AAP.
And I think what's nice about Beyfortus versus the Synagis that we used to have is Synagis is more than one dose, and Beyfortus is just one dose. It's just weight-based, which is really nice. So that's really nice to have. But yeah. So that was a lot of information to start. So maybe we'll just have a few takeaways now just to kind of summarize everything and go over everything we talked about. So the first thing is that respiratory season is a time that typically spans, again, around fall to spring. It's a time when many sorts of viruses tend to circulate, causing illness.
The second one is lots of different viruses can cause the common cold and or bronchiolitis for younger children.
Some common symptoms to watch out for are signs of respiratory distress, like we talked about, fever, cough, but again, these symptoms can vary.
And then bronchiolitis is a diagnosis that can be caused by any virus that impacts the lower airways. Remember, think about those roots at the bottom of the tree that I talk about when I talk about the bronchioles and bronchiolitis. And that can lead to respiratory distress in younger children and often hospitalization.
And RSV is one of those viruses that you can protect your child from with an antibody in their first respiratory season, which is great.
Data is extremely promising. So the CDC has reported the vaccine is about 90% effective in preventing hospitalization in RSV. That is huge. And again, we of course understand the hesitancy and that you may have more questions about this given how new it is, but we encourage you to talk to your baby's pediatrician regarding the data and the vaccine in general, as that is what we pediatricians are here for.
Yeah, and with that, we'd like to thank you for joining us today and listening in. We hope that part 1 gave some clarity and information on what respiratory season is, some common symptoms, what bronchiolitis is defined as, and a little bit more information about the RSV vaccine. Feel free to check out our part 2 for some prevention strategies, home care tips, what to look for when your kid is getting sick back to back, and when to contact your pediatrician.
Okay, see you in episode 2. Bye.
Thanks, bye.